Hi and welcome to this Wound Hygiene Bite-sized podcast. My name's Shelley Hawkins, Strategic Customer Engagement Manager at Convatec. During this bite-sized series, we'll be introducing you to wound hygiene, a simple 4-step protocol of care that anyone can do for hard-to-heal wounds. In this episode, we'll be discussing the 4th and final step of the wound hygiene protocol, dress. I'm joined by Adam Campbell-Train, Brand Manager at Convatec. During this episode, Adam and I are going to discuss dressings that are appropriate for combating biofilm, and we're going to aim to dispel a few myths. So, Adam, let's start with one of the most common ones that we hear all the time. You can only use a silver dressing for 2 weeks.
Yeah, I imagine some of the audience have probably heard this one. It's an interesting one because it comes originally from a Wounds International kind of international consensus, where they looked at a recommendation which was basically you should be using it for 2 weeks and then you should be reassessing. And if that wound, if you've got no response, maybe we think about another antimicrobial dressing. If we've improved and we've got no signs of infection, then absolutely you should be stepping down. But if you are improving, but there are still signs of, infection or biofilm within that wound, you carry on. But it's been a little bit, I guess, it's a bit Chinese whispers sometimes, where it's like, it's gone from 2 weeks and then reassess to 2 weeks and then stop. And actually there was a few years ago, a piece in Wounds UK where they were basically talking about, we think some of these wounds that would benefit from an antimicrobial dressing or a silver dressing, actually they're not getting access to it. And ultimately, when we think about antimicrobial stewardship, it's not about let's never use antimicrobials. It's about let's make sure the right patients are getting antimicrobials when they need them. And ultimately that's it. So it's 2 weeks and then reassess and then take it from there. And really should be doing that anyway, right?
Yeah, absolutely.
If it's been 2 weeks, that's a good chunk of time. So we want to think about what are we going to do going forwards for those patients.
So if our silver's working really well, we're seeing great results, assess and then continue using it.
Yeah, that's it. Exactly. If you're seeing that signs that it's still needed, but we're improving, if it's doing something, if it's working, but it's not quite finished its job yet, then absolutely, you carry on doing with what's working. That's the advice.
Yeah. And if we made the decision to step down to a non-silver dressing, but perhaps the wound went backwards, then we could start to think about reintroducing the silver.
Yeah, again, and you're reassessing at those intervals and what's the right dressing for us going forwards for that kind of next 2 week period or whatever the interval is for your local policy. But the guidance in terms of that wound, international guidance, is on 2 weeks.
Fantastic. So something else we hear occasionally is you can only or you should only use a silver dressing if the wound is showing clear signs of infection.
Yeah, that's a good one. I think it kind of comes back to what Kate was saying in, one of the second ever episode, I think. So this idea that, biofilm is not always presenting with those kind of classic signs of infection. You can have biofilm at kind of any point in terms of an infected wound. So some of those more covert signs of infection, like your increased exudate, your unhealthy granulation, all those kind of signs might not trigger as a traditional sign of infection, but that is actually probably a sign that there's biofilm in that wound. The other piece, again, I think Kate mentioned it. So there's a systematic review that was done by Matt Malone's group where they looked at hard to heal wounds or wounds that aren't healing. How many of them have biofilm in? And they found about 8 out of 10 of those wounds have biofilm in, even if they didn't have signs of infection. So we might benefit from an anti-biofilm protocol of care even without those signs of infection. Now, I'm obviously, I work for Convatec. I look after Aquacel AG Plus Extra. That product is indicated where biofilm is suspected. So it's not just about wounds that are kind of classically infected. It's about wounds that are, where we have biofilm suspected. And there's a good chance if a wound's hard to heal, if it's not healing as we might expect it to, and there's no other reason, it's not about blood flow or it's not a malignancy, all those kind of things. If a wound's not healing as we expect it to, there is a very, very good chance that there's biofilm in that wound, and it would probably benefit from an anti-biofilm protocol of care,
Yep.
which involves an anti-biofilm dressing.
Fantastic. Thank you. So coming on to the protocol of care, we've talked in great detail about steps 1 to 3 and what a great job they really do of, breaking up that biofilm. Why then, if we've done all that work through steps 1 to 3, can we not just put any dressing on at the end?
This is a good one. And you're going to have to indulge me two analogies, I think,
okay,
for this
I think
one,
we
right?
can do that.
So I was thinking about this on the way here, and I think when you hear it, if we imagine biofilm, like sometimes we imagine it as there's all these bacteria, and when they get together, they can exude this slime, this matrix that protects them. So you might hear it called EPS, you might hear it called biofilm matrix, but the idea is you've got lots of bacteria, fungi, inside this kind of protective slime. That's where we've got some of those first 3 steps. So your cleanse and debride is about trying to disrupt that slime, right? And sometimes I think it's easy to think of it like it's a can of soup and you're just taking the lid off, right? And then now we've got access and we can chuck any old dressing in and that's going to be successful. That's not actually the case. Biofilm it's more like, I have a very moldy shed at the moment, right? Okay. And that's biofilm, right? Yeah. The mold from the fungi, from the bacteria, it came in through a tent, which I should have dried outside, but I didn't, right? And it got into my shed. Now, I've thrown the tent away, but the biofilm's in the shed. It's in the wood. It's everywhere, right? And it keeps coming back because no matter what I do, I can scrub and scrub and scrub. I'm not going to get into every sort of nook and cranny. It's the same with our cleansing and debridement. We know that debridement will reduce the overall bioburden in the wound, but it doesn't necessarily change it. It's not like we're getting rid of the slime and we can just now deal with the free-floating bacteria. We've got pockets of biofilm that will hide in that wound and you'll never, ever get them out, which is why it's so important to have an anti-biofilm dressing. For my shed, I've had to retreat the inside. I've had to go ham with the Ronseal. Fingers crossed it is working for now. We're probably not going to put Ronseal into wounds. That's probably not a good idea. It's a
bit of extreme. Yeah.
Exactly. So we're looking at what's an appropriate kind of anti-biofilm dressing, and that's where something like your Aquacel AG Plus Extra comes in because it's designed to be anti-biofilm. It's designed to loosen that slime, to get through that slime and let the silver do its job to wipe the rest of the biofilm out that we couldn't get to with our cleansing, debridement, refashioning.
Okay. And we also know that biofilms reform rapidly as well. So even if there's anything left, it's going to come back quickly.
That's it, right? So, that was my experience. I think, again, Kate talked to brushing your teeth, right? You're dealing with biofilm when you brush your teeth. The reason you brush your teeth twice a day is because it takes about 24 hours for that biofilm to come back. So we're brushing twice a day to try and stop it halfway through that cycle. You're probably not changing a wound dressing and re-cleansing it for your patient twice a day. You're probably, at most, doing daily dressing changes. So that's given an awful lot of time for that biofilm to come back. So again, we need something that's going to do that job whilst you're not there, whilst the patient is, kind of left to their own devices effectively. We need a dressing that's going to help deal with that biofilm and give the patient's body the best chance to win the battle and start moving towards a healing trajectory.
Yeah, absolutely. And you touched on it in the last question around how the mode of action of Aquacel AG Plus Extra being an anti-biofilm dressing. So why can't we just use any silver dressing? If silver breaks down biofilm and bacteria, why does any silver dressing not do the job?
So that's a very good question. So again, if we think about this biofilm as like bacteria, fungi hiding within this kind of protective slime, silver is very good, a very safe antimicrobial, but it has a real problem getting through those layers. We also, I think Kate mentioned as well, these kind of like sleeper cells that really slow down their metabolism. It's not always very effective at taking those out. So it's very, very difficult for silver on its own to get through all those layers of gunge and slime in order to take out the bacteria and the fungi that are kind of hiding within that. Aquacel AG Plus Extra is very unique in that it has 3 active ingredients. So it has silver in it, but it has a surfactant in it and it has a metal chelator. So I think Dale touched on surfactants. It's basically like you're washing up liquid, right? It's the same sort of idea that it loosens up gunge, it loosens up slime. So it does exactly that within the biofilm, which is to loosen that slime, let the silver get in, let the silver do its job. Exactly the same with the metal chelator. It's got a very fancy name, but essentially all it's doing is making that biofilm more permeable, making it easier for the silver to get in, which means that we don't need tons of silver. There's actually a relatively low dose in Aquacel AG Plus Extra. It's only 1.2% ionic silver, which is less silver than some of the other silver dressings on the market. But you don't need tons of silver to dump in the wound because those other active ingredients have helped to loosen the biofilm and let the silver do its job more effectively without needing more of it.
Fantastic. And in those great results we talked about with Rachel with the wound hygiene challenge, it was Aquacel AG Plus Extra used at step 4 each time, correct?
Yes, that's correct. Yeah. So that was the rest of that kind of first 3 steps was based on what's the local protocol of care. And then step 4 was Aquacel AG Plus Extra as indicated as that kind of primary dressing, which gives us again a bit of a sense of how does that work in the real world, right? If you're in practice and you've got X, Y, Z as your cleansing and debriding products, how can I have confidence that wound hygiene as a protocol and AG Plus Extra as a dressing are going to achieve some good clinical results? And that's exactly what that study does.
Thanks, Adam, for telling us all about AG Plus Extra. We hope you found this series of bite-sized podcasts on wound hygiene useful, and we hope you'll join us for the next series.